guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Every Tuesday, I take all of the questions that have been submitted through viewer comments, from emails, and through Instagram, and I roll it all into one episode to give you guys the #1 question and answer show about medical coding, airing on Tuesday. So, without further ado, let's get started. But if you would like to have your question answered for next week's Q&A Tuesday, I hope you'll comment below. Special shout out thank you to everybody who submitted their question. So, let's get started. All right, first question. What are your thoughts on having credentials from both AHIMA, the American Health Information Management Association, and AAPC, the American Academy of Professional Coders? Would a coder be okay if they just stuck with the CCA, the Certified Coding Associate, or the CPC, the Certified Professional Coder? And they are the credentials with the respective coding associations. AHIMA is with the CCA, and the CPC is with AAPC. Here's the thing. This is my advice, and different people look at it different ways. Sometimes people think that if they have a slew of credentials after their name, it's going to make them more marketable, when this is really not the case. I have known many successful coders who have just one credential, and they do just fine in their positions. They do really well salary-wise, and they do really well in their professions. So it really is a personal choice. I always recommend, if you are brand new to this field, to start out with one credential, because it's going to depend on the credentials that you're adding to your name, right? What is it saying? And is it being redundant? If somebody was to get both the CCA and the CPC, both of these credentials say that you can code in the outpatient setting. They're just with one with each association. When you are looking for jobs, most times when employers are looking for coders, they're looking for them to have at least only one credential. When you start looking at the specialty certifications, like being a clinical documentation improvement specialist, the CDIP, and that is with the American Health Information Management Association, or you're looking at something else like the Certified Risk Adjustment Coder, the CRC. These are different specialty things. So you really do need to kind of consider and weigh the costs and the benefits of having these additional credentials. Yes, does it look really good? The CDIP, of course, because this says that you can do clinical documentation improvement. Any medical coder can do clinical documentation improvement. It's just these credential holders have had formal training as far as like being able to pass this test. And maybe they have done independent study, but they have had some sort of training when it comes to these types of different specialty credentials. So really look at that. If it's not going to make a difference in your employment status, then really think about why would you consider adding on additional credentials, because you have to maintain them with continuing education units. So that is more money. You have to think about that. People who have an alphabet after their name have to come up with a considerable amount of continuing education units per year. And when it comes to your employer, sometimes this is a benefit of employment, but other times you're going to have to come out of pocket for these continuing education units. My employer gives them to me as a, well, I have to go to the classes, but it is part of my employment package. So that works out really well for me. But at the same time, again, if you are adding on additional credentials, you have to keep in mind the cost of maintaining those credentials as well. So it is a personal choice, but my recommendation is to start out with just one. And if you want to do something else, if you want to add another credential on, consider everything before you do it. Okay, so next question. Are medical coders used in mental health or drug addiction facilities, therapies, or rehabs? Thank you again. Yes, there are plenty of coders for those positions as well. When you're looking in the job listings, they'll tell you what kind of facility it is, and a lot of times it will say if it is a mental health or a rehab facility. So yes, there are those different specialty settings that coders are needed in. Okay, next question. Hi Blue, I have a question. Where is the best Where is the best place to start a billing or coding career? Close to the end of a course. So there really is no best place. And as far as like, sometimes I get the question, I know this viewer didn't say easy, but a lot of times I get the question of where is the easiest place to start? I want to start it with something easy and then work my way up. When it comes to medical coding, there is going to be nothing that is going to be easy. After a while, it will be easy. But if you start off with something easy, that is what you're going to get confident in, and then it's going to make it harder for you to want to move on to something else because you got really confident with this. So my recommendation is to be open to trying anything. Be willing to say yes. Anytime your employer says, well, do you have a particular specialty that you like to work in? Say anything. Any position that is open for their coding department, you are willing to take on. You have to be willing to accept those challenges. There is no best place to start. When it comes to medical coding, wherever you can get in is where you fit in. It is difficult in the beginning for new medical coders to get jobs. So if you can get your foot in the door starting any place, that is what you want to do. Sometimes medical coders start their careers in the billing department, and that is perfectly fine too. You don't even have to be certified to be a medical biller. So you can still be in school and get a job as a biller because they will train you. A lot of times when billers are being trained, they're being trained because they're processing paperwork. And yes, while they're looking at diagnoses and procedures all day, it really is on the coder, or maybe it is the physician that is submitting the paperwork to the biller, and the biller is submitting it on to the insurance company. And they're taking care of the money side that way. If that is the case, then you will still learn a lot. You will still learn a lot about the insurance company, about the procedures, and about the diagnoses. There's still a lot that can be learned in the billing department that can translate and transfer over to being a medical coder. Because like I said, a lot of medical coders get their start off in the billing department. So whether you start off in billing or whether you start off in coding, always be willing to accept new challenges. Say yes to everything. Don't be resistant, and don't ask to be put into the easiest clinic, or I want to go slow and I want to try to get my bearings. It's always going to be where you kind of feel overwhelmed because it is a lot of information in the beginning. I didn't start to lose that feeling of this is a lot until maybe 3 years in. And that is when I started to feel semi-confident in what I was doing. I mean, I knew what I was doing, right? But at the same time, what I know now is so much more than when I started. And I didn't even think to do all of this other research to make it easier for myself. I didn't know to do that in the beginning. I didn't have that until I had my aha moment in 2014 when I started to be like, oh, now it clicks. This is what I have to do to make this easier for me to understand. So when you have those moments and it's like, oh, okay, then you start to learn how to research. And when you learn how to research, that is like the biggest key to medical coding. Researching is power, right? It'll help you because you know how they say knowledge is power? Research in medical coding is power. You don't have to know everything, guys. You just have to know how to look up the answers. And a lot of times people feel like frustrated because they don't know. There's the internet. The internet is filled with answers, and so is YouTube. YouTube has a wonderful thing that anything and everything you wanted to learn about anything is on YouTube. Whether it is anatomy, physiology, medical terminology, anything. Trust me, you can find it on YouTube as well. So take the time to really start to dig into the things that you are trying to understand. If you don't understand something, yeah, reach out for help and try to get somebody to help you as far as like answering a question or so. But if you are brand new in a clinic and they plop you into, let's just say, gastro, then you need to go online and start looking at all the procedures that gastroenterologists do. right? And you can always ask the clinic that you're working in, what are the most common procedures performed in this clinic? Or what is a general overview of all the procedures that's performed in this clinic? You don't want to ask, what are the procedure codes? Because when you do like cheat sheets, or when you take somebody's cheat sheet and you're just saying, oh, okay, these are all the ones that we do, these are the procedures, and these are the codes. You have to make sure that the documentation matches up to what's going on before you just start blindly reporting all of these codes. You can't do that. That's why cheat sheets are so bad. I don't recommend cheat sheets at all. A lot of people ask for those, and I'm like, no, I don't have them. I don't use them because of the simple fact that every single document is different. Yes, I do have for me, my own reference, like where I know that this block of codes is for this particular specialty. But it doesn't always mean that that's where I have to kind of zero in at. I have to look at the documentation and comprehend it to make sure that if there isn't something else that's going on here, that I don't report that other thing, right? And again, just not getting into that complacent status of just being like, okay, we only report this, and we only report this, and we only report these diagnoses. You have to make sure that everything is lining up and everything is matching up. And if it is, always make sure that you talk with your doctor as well, or your provider, nurse practitioner or PA, and make sure that you're talking out like what's happening in these visits. Because I have done that with brand new providers that I've had. I've had to go in and rescue clinics. And a lot of times when I get to just talking to them, like just normal conversation, you know, what does your visits look like? What typically do they look like? And they start telling me. Well, then I start looking at their documentation and I'm reviewing it and I'm like, where is this? Oh, well, I thought we didn't get paid for that. So, you know, I wasn't sure. Okay, well, everything that you do in that room, I need to see on this paper because I'm not in the room with you. I don't know. Well, it's just common sense. No. You know, the thing about common sense is that it ain't so common. With medical coders, if it's not documented, it did not happen. And this is for the safety of the provider and the coder and the patient. You never want to assume anything. You have to question everything. So with that said, that is the answers that I have on that one. There is no best place. Just basically, you just got to dive into the deep end of the pool and just swim. Just swim as hard as you can. And eventually you'll get there where you're going to be this champion swimmer and you'll be able to learn how to do your research, and it will get a lot easier for you. I have done a lot of different clinic settings. I have done a lot of different specialties. I am confident that any place that I go to, I could just be plopped in there in a couple of days and I'll be able to really understand everything because I know how to do research. And once you do that, you'll be able to get it. All right, so next question. I am a registered nurse in the Philippines and I work for a hospital a couple of years, but I stopped due to health reasons. I want to try medical coding as a fresh start, but the online courses in medical coding is very expensive. I hope someone will help me or refer to any affordable online course in medical coding. I did do a video, the step-by-step sequence for independent study. If you are wanting to do independent study and you have a general background in medical already, this would be good for anybody. Anybody who likes to read, anybody who likes to study. The program that I outlined, it is just a basic template of what going through an actual program would look like. If you follow it and you go through the steps, it's like 12 months. It can be less than that, but that is generally like the rough estimate of what it would take. If you're going to go through it much more quickly, then you can. As I said, anytime that you start in a medical coding program, go for at least 9, 12, or 18 months. I got through my program in 6 months, only because I am a reader and it was easier for me because I could study. And I like to study, and that is something that I enjoy. And there's not a lot of people that like to do that, but I like to do that. So that is why I got through the program so quickly. But that pace is not for everybody. there are people that they have to take their time, and it's okay to take your time, because your journey is going to be different from my journey and from the next person's journey. So however long it takes you, if you're going through at a steady pace, the way that the template is, you'll get through in 12 months. But as I said, you know, if you have experience in other things, you can take some of that time off and get through in a shorter amount of time. But there are alternatives to that. There's studying on your own, because the CCA, or the Certified Coding Associate, and the CPC, the Certified Professional Coder, do not require you to go through a formal program. You can do independent study and still be able to sit for these certification exams. So it is entirely up to you. I will leave that video for the independent study sequence in the description box below. So if you're interested in doing that, that is what I can suggest. So that would be the cheapest way. But again, if you have to have somebody to teach you, I would go directly to the associations themselves. They do have online medical coding programs. That is literally the only ones that I can truly vouch for. A lot of people ask me about these different online programs. I can't recommend them, guys, because I didn't go to them. I went to a temporary. I went to a trade school, but that trade school is no longer there. So again, the only ones that I can truly recommend is going through the associations themselves. There is no middleman, and they are a fraction of the cost compared to the other trade schools that are online that charge you $10,000 or $12,000 or $20,000, where AHIMA and AAPC run roughly less than $4,000 each. You know, so by the time it's all said and done with the books and everything, so that is something to consider. Okay, next question. Hi, Blue. Thank you for all of your videos. I am so interested in medical coding. I studied dentistry back in my country, but I'm not practicing here. I love the field of medicine, but somehow I wasn't able to practice my field here in the US. I am detail-oriented, and medical coding really interests me. I'm not sure where to start, so I'm thankful I discovered your channel. I choose AHIMA, but there is a lot of choices under online courses. Not sure which one to pick. Please help. Thank you. I was referring to the education by product. There are 3 courses: medical reimbursements, cancer registry, and healthcare data analyst. I assume I should pick the first one, correct? Thank you in advance. So these are the specialty programs. So that's not what you want. You want to focus on studying for the CCA. There are educational requirements for the CCS, but you have to look on the association website. Now, it has changed a little bit, and I did leave the link for the Coding Basics bundle, but now it's moved. So you do have to go online. I would recommend calling AHIMA customer service, since there has been a lot of changes, and seeing where their online medical programs start. But no, you would not start with those. You would start with whatever they tell you, because it's going to be like the ICD-10 CM bundle or the ICD-10 PCS if you are studying for the outpatient side. But yes, I would start off by calling AHIMA customer service, and they should help guide you through that. Okay, and the next question. A viewer commented about alternative jobs. What about claims? So claims is synonymous with billing, and that is what claims is. So if you see a job ad for claims specialist, they're talking about a billing person. So next, this is the last question. I am just starting to get into coding CPT and an ICD-10 CM code at the same time. So I'm thinking that she's doing scenarios now versus just doing look up this code for diagnosis and look up this code for procedures. Okay, she's doing the scenarios now. How do I know when to use more than one book? Lastly, can a CPT, ICD-10 CM, and a HCPCS be all used to identify the same procedure? All right, so let's break this question down a little bit. The ICD-10 CM book is your diagnosis book, right? The CPT book, or the current procedural terminology, is the outpatient procedure book. The HCPCS book is the HCPCS, and that has to do with all of your durable medical equipment. It has the codes for, like, if there's injectable drugs, like something like a steroid or something like that. Not like your like lidocaine and bupivacaine. That's not talking about those, because you wouldn't pick those up, because that is considered part of the procedures, right? That's the numbing agents. So when it's talking about doing like an injection, they talk about like all of those things, you wouldn't pick those up. You would be picking up more like the medications, like the steroids and whatever other pain relievers that they're injecting into this patient. So yes, in some scenarios, you are going to be using all three. You are always going to be using the diagnosis book, which is the ICD-10 CM book. When it comes to the CPT book, that's going to house your evaluation and management and your procedure codes. So not always are you going to be able to report an evaluation and management. It's going to depend on what is happening in the encounter. Okay? If you are just reporting a procedure, you have to have a diagnosis in order to go with the procedure. And if, say for example, you're doing an injection, right? Then injection is being done on the patient. They're having an intra-articular injection into the knee for pain relief, right? So this would be arthrocentesis. So let's just say it's for osteoarthritis of the knee, M17.0, right? Off the top of my head, yes, bilateral knee osteoarthritis. And you go to report the 20610, that's arthrocentesis of a major joint, because the knee is considered a major joint. And let's just say they injected Kenalog, 40 milligrams of Kenalog. That would be the J3301. Yes, I use these codes quite often. That's why I know them off the top of my head. That would be an example of using all three books at the same time. The ICD-10-CM, the CPT, and using the HCPCS codes. Now, if it is just a follow-up visit and there's nothing going on, no procedures being performed, then that you're still going to be using the CPT book, but the evaluation and management is housed in the CPT book. That is why you would be using the CPT book in addition to the ICD-10 CM book. The HCPCS book, again, only comes into play if the patient is being treated with some sort of injectable like medication, or there's some durable medical equipment being given to them, or perhaps it's for casting materials. If they've fractured themselves and they're coming back for a replacement cast, you can report the HCPCS code for like the cast materials, like the fiberglass or the plaster. And that's when you would be using those types of codes as well. So it's hard to sort of explain it, and I hope I didn't confuse anybody, but that is generally what it is. It's going to make sense once you've had more time and practice into doing whatever you're doing. Because as you're learning, book coding and real world coding are going to be two different things. And it's going to, when you're out in the real world, you will understand what I'm saying. It will start to make more sense. But as you spend more time with it, it is going to get easier. So you can, take some comfort in that it will get easier after a while. But don't get frustrated with it, whatever you do. It happens to all of us. But it's something that once you start getting to learn it, it will be more like, oh, now I get it. And I really do recommend going to like websites that would help you. JustCoding.com. I do recommend that one. This is not an ad for Just Coding, but Just Coding has a free subscription site. I will leave their link down in the description box below. That website does give you access to free coding quizzes, whether it is diagnosis coding or procedure coding, inpatient or outpatient. So I really recommend that you guys check that out. And they do have access to other free articles that is on the site as well. So that is something that that's a free resource for medical coders. So I would strongly recommend that. All right, I'm going to go ahead and wrap this one up. I hope you've enjoyed this, and I will see y'all again for tomorrow's episode. I hope you hit that like button and share this if it helped you. Alright, so if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!